vaccination for PharmD aspirants, organized by our ex-doctors, organizing partner ST Premier Clinical Research Institute, powered by EWTI Overseas Educational Career Consultant, our esteemed educational partners, Vagdevi College of Pharmacy, Tugari Velamalappa Memorial College of Pharmacy, Bellary, Jayamukhi College of Pharmacy, Akshaya Institute of Pharmacy, Sri Abhirami College of Pharmacy, Seven Hills College of Pharmacy, Keli Academy of Higher Education and Research. It's me, Jenny from LC, your moderator for today. And let's dive into today's session. We'll be having two wonderful speakers who'll be taking us into a beautiful insight. So let me tell you about something chemotherapy. So clinical pharmacists are indispensable members of oncology care team, particularly in the complex process of chemotherapy. Their role begins with a meticulous review of chemotherapy orders that is given by the physician themselves to ensure drug selection aligns with the patient's cancer type, stage, the genetic marker, and comorbidity. It is basically a personalized treatment, you can say. So they perform a precise dose calculation based on the body surface area, renal and hepatic functions, and laboratory parameters, thereby reducing the risk of overdosing as well as underdosing. So the dose selection, the dosage which has to be given, the unit in which has to be given, the IV drip rate, everything is calculated by the clinical pharmacists themselves. The clinical pharmacists are highly skilled in identifying and preventing the drug food, drug disease interactions, as we all know, an essential safeguard given that chemotherapy patients often receive multiple medications, including supportive care agents like antiemetics, growth factors, and antibiotic. In spite of we can say that they're given for the betterment of their life, there are more adverse events that has to be addressed, and those are all looked over and addressed by the clinical pharmacist to be exact. So beyond dispensing, they provide comprehensive patient education explaining the purpose of each drug, potential side effects, and strategies for self-care, with empowers the patients to adhere to the therapy and report the early signs of complications too. They also play a crucial role in monitoring treatment responses and adjusting therapy based on toxicity grading and clinical outcomes. So they work hands on with the physician for the betterment of the patient by staging up to date data with evolving oncology guidelines and clinical trial data. Clinical pharmacists contribute to evidence based personalized treatment plans. In doing so, they not only enhance the safety and efficacy of chemotherapy, but also improve the patient's quality of life, reducing hospital admissions due to adverse events. So they can be admitted for the treatment, but not for the adverse events, and support better overall survival outcomes. With that being said, what better would it be if a person from a clinical pharmacist himself come and take us into the every step-by-step guiding in the chemotherapy by a clinical pharmacist? And that's why we have a beautiful and eminent speaker, Dr. Manu Ashok Jaishwa, a PharmD graduate himself and an oncology clinical pharmacist in Apollo Hospital, Navi Mumbai, will take us into a topic by step guide and practical tips for establishing the sterile chemotherapy drug admixing unit. So, with no further ado, please do join me in welcoming our speaker today. Welcome, sir.
Hello. Hello, this is Dr. Manu Ashok Jaiswal as a PharmD working as an oncoclinical pharmacist at Apollo Hospital. Hello, I am audible?
Hi, sir. You're audible, sir.
Yeah, shall I start my session?
Yes, sir. Whenever you are.
Yeah, okay. So today my topic is step-by-step guide the practical tips for establishing a sterile chemotherapy or drug preparations. In that, the first step here is that the hand hygiene. Hand hygiene is a very important and it plays a very crucial role in that also. Because if we not follow that hand hygiene step, it might be there will be chances of a JNB or patient might be have a continuous fever spike in that, and fever spike is not good for the cancer patients. So that's why the hand hygiene is very important before doing any compounding or administering of a chemo drugs. In hand hygiene, generally we are doing a palm to palm, then right dorsal on left dorsal, then rotational thumb rubbing, then interlocking the fingers and rubbing on our palms. Then second one is the workflow, how we are working in the Apollo, like what is the workflow for any cytotoxic drug administering. In that, the basic step is that the protocol is only written by a registered oncologist. After that, that protocol is changed take by an onco clinical pharmacist. In that, the CP role is that they will calculate the dose as per the body weight. What are the patient's height and weight, and as per that they are writing the BSA, and the dose calculation was given by a doctor. So that verified by a clinical pharmacist. After that, the medicine indent by a nursing staff, and it will go to a online prescription auditing. Also, in that the one CP is there who will again cross verify the prescriptions, their doses, and their strength. After that, that medicine will be a dispatch and dispatch in a chiller box because the chemo drugs are maintain the cold chain medicines. So once it's send it to a daycare, then it will send through a UV pass box into a unit. Then after that, once the preparation is done, again the same from the area of preparation, it will send back into a your pass box. Then it will go to a patient care area. Then introduction that the OncoCP plays a very important role regarding the dose calculations or uh, or implanting a good and safe and sterile preparation for the drug, which increase the quality of the drug and the patient's care life also in that. The compounding of sterile preparations requires high quality of standard to ensure the preparation quality and the safety. The parenteral therapies are becoming more complex and the patient may now the receiving a continuous antibiotic or chemotherapies. The next slide is the biosafety cabinet. Then the next is the biosafety cabinet. In that, we have different parameters like laminar hood, then underpad, sterile empty tray, vacillol, personal protective equipment, gloves, gown, hair, shoes, goggle, face masks, UV light, chiller box, refrigerator, three types of color-coded dustbins, and then negative and positive pressures, cleaning, disinfectant, sterile, required skill, responsibility of a compounding person, and workflow of the cytotoxic drug admixing. The first one is a biosafety cabinet. In that, we have a laminar airflow machine where we are preparing a drug. That laminar airflow is a closed bench designed to prevent the contamination like a biological particles and other particle sensitive device. This closed cabinet is usually made of a stainless steel without any gap or where the spores might be colored. A laminar hood is equipped with a shorter ultralight geometrical lamps that style the shell. This machine is the machine is help in a to kill the germicide. If any outside contamination is there, then the airflow will be useful in that. Then in laminar hood there are two types of laminar hood. One is a vertical laminar airflow and horizontal laminar airflow. In vertical, the airflow will be like in a vertical way. In a horizontal, the airflow is in a horizontal uniformation direction. Then underpad prevents the direct contact of during the preparation of cytotoxic drug and the surface of biosafety cabinet. It also prevents from the direct contact of cytotoxic drug spillage on the surface of the biosafety cabinet. And sterile empty tray, it is used to discard the excess amount of NS or dextrose or any other saline or water. Then bacillol. Bacillol is a highly recommended for the disinfectant and the equipment, and it is also effective in all against types of bacteria, fungi, and virus. And it is also disinfectant for the purpose of cleaning biosafety cabinet and the cytotoxic drug preparations areas. Then personal equipment, the gloves, gown, hair cover, shoes cover, and the goggle mask. The gloves is important if any spillage on a hand, then it will be a preventive. It will work as a preventive. And gown is a totally waterproofing. If any drop will fall, then it will not get absorbed. Get absorbed. Then UV passbox. UV passbox is completely like a completely with a UV ultra rays, and this pass medium is prepared. The drug pass from the side of the drug preparation area to the patient side, and a passbox is a cleaning the process done on the daily basis. Maintain the sterile UV box, and passbox is utilized for the aseptic transfer of the material between the two controlled area without the need of any personal intervention. Then the chiller box is clean with a bacillol and used to deliver the medicine from the patient area, and and ice packs are kept inside the chiller box so that the temperature of the box is maintained while they're transferring the medicine from one area to another area. The refrigerator is used in a two-way to keep the unused and balanced dose of the patients. There are the some cytotoxic drug which can be used for the multiple dose such kind of a while are stored in a refrigerator instead of discarding the medicine. The refrigerator is temperature should be monitored between a 2 to 8 degree. There are some drug which can be used as a multiple while, and the drug like a trastuzumab and nivolumab, they are a very costlier drug. So we are not discarding. Instead of discarding, we are keeping in a refrigerator with a maintained temperature 2 to 8 degree. Now there are three types of color coded dustbin. One is a white one in which we are discarding the sharp needles and ampules. After that, the yellow color cytotoxic symbols. In that, we are generally discarding the underpad, mask, gloves, PP kit, all things. And black covers, generally cartons and cover of the syringes. Wearable air sampling, the evaluation of airborne microorganisms using the volumetric collections methods. In a controlled air environment shall be performed by a proper trained individual for the oral compounding the risk level. Air sampling shall be performed at the location that are prone to a contamination during the compounding activities and during other activities like the stagings. The consideration should be given to overall the effect of the chosen sampling and method to have the unidirectional airflow within the compounding of the environmental. In that there will be a negative and the positive pressure. Negative pressure and the positive pressure is very important that so that the outside air should not get entered into the adjacent area where the drug preparation is happening. The negative pressure is generally the room that is a lower pressure than the adjacent side, and positive the room that is a higher pressure than the adjacent space, or therefore the net airflow out of the room. Then cleaning and disinfectant. The cleaning of the room is done once in a week with the help of the basilol. Once they spray the basilol, then they will keep for half an hour. After that, they will start doing the mopping with the wet wipes like that. And for the cleaning purpose, if the basilol is not there, then they might be used the 70% of alcohol also instead of the basilols. That requires a licensed pharmacist should be there and should have a 5 year of experience and have a good knowledge regarding the medicines and the disease and the treatment also, and the basic knowledge of compounding sterile preparation of the principle of the stability and the compatibility, and having the good knowledge of handling of hazardous material also, and having the knowledge of patient assistance program. Patient assistance program is it is a PAP scheme which is given by a company. In that, they if they buy one vial, then another vial will be the free. This will be the beneficial for the patients if the drug is very costly. So that in a PAP scheme they will get 1+1 purchase and one vial will be a free. So that knowledge should be a have the pharmacy should have that knowledge like and familiar with the availability and the structured design of the clinical trials. Postgraduate certification in oncology pharmacy is recommended. Must have accredited certification of healthcare administration and health system, pharmacy administration, and the business administration. The responsibility of the compounding person is that to ensure that dose should be correctly calculated by a clinician as per their BSA, and the protocol should be followed with the company leaflet, whatever mentioned by a company, and the skill knowledge of the person who prepare a CP have the rigor of in the process of the quality control check and the post compounding the quality inspections is the testing increase with the potential hazard and the route of administration. For the example of the non-sterile and excessive bacterial and endotoxins. Thank you.
And now it's over to the audience. If you have any questions, please do put it in the chat box, or you can unmute yourself and ask Sir directly. Sir, as an oncology pharmacist, could you tell us about the errors that you witnessed and the strategies to overcome us? Some examples, sir.
Hello. Hello.
Yes, sir. Could you?
Yeah, can you repeat the question, please?
So, as being an oncology pharmacist, could you tell us some of the errors that you have witnessed during your duty and how you plan the strategies to overcome those?
See, I'm like as a onco CP, we also reading every day that company's leaflet. In that, they are mentioning the standard dose of the patient, loading dose, then a dose tapering. Apart from that, if any reactions happen, then what premix should be given, and for that also they have the particular like dosing. In case of rituximab, generally the physician or clinician are writing a 500 ml 500 ml over a 5 hours. It means it will go 100 ml per hour. In that, if we directly connect 100 ml per hour, patient might be having a chance of shivering or rash allergic. So if you go through a leaflet, so it mentioned that the rituximab always start as a 20 ml per hour, so that the risk of allergic reaction should be avoided in that. Hello.
Yes, sir. And then one more, sir. What do you think that a family graduate or a family student who is undergoing to get into a clinical pharmacist and oncology department should prepare on before getting into this? What are the things that he should be focused on?
They should know the basics of the classification of the drug, then the disease, and what are the types of cancers and their staging, and the basic calculation of the dosing and all like.
So, could you tell us about your future plan, whether it is to continue the onco in India or any abroad plans or in fellowships or stuff?
My plan is after 1 year I will give the exam of a board certified oncologist. After that I will look to go outside.
Okay, sir.
Yeah.
I think that's it from the audience too. So thank you so much for joining us, sir. Thank you so much for giving us a short and crisp introductions and everything. Thank you so much, sir.
Yeah. Okay. Welcome.
And now, everybody. So today is a wonderful day, as I've